presentations on concussions and return to play. My internship was with Dan O'Connell with the K-Dub football team, and had the pleasure of working with the team the whole entire season from 2 days all the way until the last game against St. Mary. Got to see a lot of different things. One thing that interested me a lot was the way he handled concussions, because I'd never been around it, never really seen it. Like, I've been on teams where someone did get a concussion, but I didn't get to see the whole protocol and how they were tested and everything like that. So I think that was one thing that sparked my interest. That's why I did the research. So to give a little background, concussions defined by the Mayo Clinic as a concussion is a traumatic brain injury that affects your brain function. And it's usually suffered by a blow to the head or a blow to the body, causing the head to either snap back side to side and causes the brain to run around inside your skull, gives bruising, some bleeding, and it just really kind of messes you up. I've never had one, so just from research. And as of right now, like, if you look in the news, especially the sports news, almost once a week there's someone with a concussion, and it's discussed about the protocol on how it's taken care of, how it's diagnosed, things like that. And especially in the NFL now, they have teams of doctors, double-digit doctors at every game, some in the skybox looking down, watching players, some on the field. And if you see a player get hit hard, you'll see them come up to them on the sideline and pull them out and run through a quick thing of test, make sure they're okay, or follow up with more concussion protocol. One of the tools that Dan used and one of the tools that I found when I was researching was the sports concussion administrative tool, also known as the SCAT tool, and it's on its 3rd version, which is the most up to date. It's also used a lot around sports, and also I believe by the Olympics is what I was reading in my research. And it's got 8 sections for the athlete to complete, and it's the Glasgow Coma Scale, which kind of sees if they know where they are, things like that. The Maddox score, which is I believe like knowing what time they're in, like date, things like that. Symptom evaluation, which goes through what they're feeling, so like headaches and things like that. And I'll get into more of these as we go on. Then the cognitive assessment, neck balance coordination examination, and a delayed recall. So first is the symptom, or I guess the third thing is the symptom evaluation. There's a list of, I believe, 22 questions. They rated on a scale of 0 to 6. 0 being none, 1 to 2 mild, 3 to 4 moderate, 5 to 6 severe. It's on headaches, dizziness, nausea, sensitivity to light, sensitivity to sound, increased anger, trouble to sleep, things like that. So they can come back and they can retake that test each and every day until their scores are all 0. And that's when they'll start like the return to play protocol, which I'll talk about in a little bit. The next assessment is the cognitive assessment. Orientation, they ask what day it is, what the date is, if they know like the numerical date, month, year, around what time it is during the day. Usually within an hour is considered normal. Immediate memory, the trainer or the physician will list 5 random words, usually about 5 to 6 letters, something easy to remember. Have them repeat that back to them 1 to 3 times. See if they can do that. And then concentration, they'll list 3 digits, have them listed back to them backwards. And if they pass, they go up to 4, 5, and 6. And do that. And then months in a reverse order, so they have to think on their feet. They don't start with January or December. They start with a random month. They have to go backwards. And all of these are scored out of pass or fail, and then totaled up at the end. The physical examinations are the neck examination, tests range of motion, see if they have any tenderness, and see if they have sensation and strength in both their upper and lower limbs. The balance examination is a double leg stance, so to see if they can stand on their own. Then they'll go single leg stance on their non-dominant foot, see how that does, and then a tandem stance, where one foot in front of the other, non-dominant foot in the back, see if they fall over, any swing, stuff like that. Then a coordination examination is just taking them through, see if they can just do normal things like shake your hand, raise their hand, go through all the range of motions. Once that's complete, and once the symptom evaluation, as I said earlier, scores of all 0, I'm going to start the return to play protocol. And I talked to Dan about this and got his feedback on what he was saying about it and how he did it and what I saw. The first step would be light aerobic activity. So athlete comes in, score all 0s. Dan will say, hey, let's go down to the weight room and run for 20 minutes on the elliptical, bike for 20 minutes, something real light, nothing too exertive so that they keep their head controlled and their blood pressure and heart rate controlled. The next, if they do not suffer any, or their scores are all 0s again, after that, then the next day they'll continue on to the next step. See if any of their symptoms are up. They'll go to team warm-up, so they have, I believe, what they call skelly, where they just stretch as a team, and then they would do sprints on their own. I believe it was about 5 to 8 40-yard sprints, about 75% of their max exertion, just to get their heart rate up, blood pressure up, and see how their body responds to that. If they keep continuing to score 0 on the symptom scale, they would go into the team warm-up and individual drills, so going through specialty drills with their position players, and but they'd still have no contact at all, like hitting and stuff like that. The next step would be full participation in practice, so pads, helmets, everything, and then but they don't have light hitting, making sure to keep away from the head so that nothing else happens. And then if they pass that, they can go on to full participation, full contact. Usually Dan liked to have the person or the athlete participate in one full practice with full hitting and full everything before he cleared them for the games. And then one of the research articles I found was about the NBA. They did a study from 2006 to 2014, and their data came out in 2016. They looked up their sources were media and public files that the teams would release, and they recorded how many concussions were suffered during the seasons and separated them out, and it came out to be about 14 to 15 concussions per season. And then they would measure how many games that athlete would miss between or right after their concussion to see how their return to play protocol was going. And then in 2011, right before the 2011-2012 basketball season, a concussion protocol was instituted for the NBA and for their athletic trainers, and they had to follow that, meaning like they had to see different doctors and things like that to make sure that they were okay, didn't get a second concussion. So the average games missed between 2006 and 2010 before the protocol was introduced was 1.6, which is really low because they're playing back-to-back nights a lot of the times. And if you look at football, they could be out for 2 weeks with just a mild concussion. And then after the protocol was introduced, the average games went up to 5. And then another thing I found interesting was the last year, 2014, was the only year that players missed at least 2 games or more. Every other year before, players could miss 0 games before going and returning to play, which I thought was interesting because usually off a concussion you have probably about 5 days or more or less, but around 5 days before you can actually return to play and your symptoms are all gone. But the NBA, even the article stated that some players returned that game, which was interesting because if you're concussed, you don't want to be impacted by the second impact syndrome, which I'll get into right now. The second impact syndrome occurs because of rapid swelling and herniation of the brain after a second impact. So if a player is on the football field or basketball court and they have suffered concussion previously in the previous week or previous game, previous day for practice, and they're out there again, they get hit pretty hard, jolt the brain around. It's life-threatening, and it's approximately about a 50% mortality rate. And second impact syndrome, read an article about, or the textbook that I got some information from, said the best way to prevent second impact syndrome is to not let it happen. So make sure that each athlete has cleared the return to play protocol and is symptom free, and they know, athletes should know that what this is, and if they're going to lie to their athletic trainer, their team physician about their symptoms, they could possibly die from it, and the sport is not as important as their life. So it's really important for the athlete to know, the trainer to know that they're symptom free and things like that. Any questions?
Yes, I do. Okay, well, let's see. I wrote down in terms of the you talked about the growing presence in the media, and I was wondering if you got any sense of what positive outcome comes of that. I mean, is this making concussions more understandable to the general public, or do you think it just provides just sensationalism? I mean, we know how many concussions, but are people learning from it, or is it just, wow, let's watch, the guy just got a concussion?
No, I think it's definitely helping people learn more about concussions because, I mean, 50 years ago, I don't think there's much to know about them other than someone got their bell rung or got a little caught up. And now you don't see that at all. Like, studies are coming out more about CTE, which I don't know the meaning of that offhand, but something caused by multiple concussions. And there's rules in youth sports and every sport, really. If you have a certain amount of concussions, you should be done. Should be cleared by a doctor. And I think it's especially important in youth sports because if a young athlete, say like 10 or 12, suffers a concussion and they just think, oh, or their parents just think, oh, it's a headache, they'll be fine tomorrow. I think it's helping them understand that it could be a concussion, it could be made worse by going back out there and keeping playing. So I definitely think it's helpful.
You talked about the NBA.
Yep.
And 14.9, let's call it 15 concussions. Was that per player, per team, or the entire NBA? What was the 14.9 what?
It was 15 concussions per year total.
For all of the NBA?
Correct.
That's not bad.
No, it's really not, but
I thought, if we're not looking at it, it's probably not per person, but maybe it's per team.
Yep. 15 for the whole entire league. But, I mean, I saw that too, and I thought it was low, but then I was thinking about it. Basketball's not really a full contact sport.
That's right. Yeah.
So I was like, it makes more sense.
Yeah, and if a guy gets hit with something in the head, it's usually the basketball.
Yep. That doesn't hurt too bad.
Now, the last one I wanted to ask you has to do with this last topic about the 50% mortality rate with the second impact syndrome.
Yep.
And I had two questions related to that. What form of death is most common?
I believe it's bleeding on the brain and not being able to stop it by the time they get to the hospital because the signs and symptoms are just like a regular concussion, but everything moves much faster, so you have a short amount of time to get them to the hospital. And even like someone could just get, the textbook was talking about someone could get hit in the chest and their head go back, and they could feel fine, but they could drop minutes later. So
if it was a stroke or what it was, so it's internal bleeding and
correct
cranial cavity.
Yep.
And then what happens to the other 50%? Do they all walk away, or is it varying stages of not dying but being hurt? What are the questions on that?
I believe it's varying stages of how badly they're injured. Like, say if someone goes through the protocol and only has like a slight headache, like a 1 or 2 on the scale, and they get cleared to play, I don't think it's, maybe their concussion's going to get worse, but it's not going to kill them.
You mean the second one?
Correct, yeah. The second hit is not going to kill them, but if they're still coming off a concussion that's still hurting them in multiple areas, I think it's just their brain hasn't had time to heal yet. So
the controlling factor then on second impact syndrome is that they haven't healed from the first one.
Correct.
Is there any statistics data, put that word together and figure out how you say it, the statistics, how about that? Where you have someone who's totally healed, but then they get
I did not find any research on that.
Would you have, I mean, it's not the same thing. It would be like another first word
Correct.
kind of idea.
Yeah. Like if you say a football player suffers a concussion, maybe preseason, they were just during a game, get hurt, and they sit out maybe 2 weeks just because position and making sure, and then they come back and get a concussion again. It should be just like restarting the process rather
Because I
than.
know people get more than one.
Yeah.
In football. That
Yeah,
happens
exactly.
A lot.
But if they consistently, I guess, say if someone has one week and then 2 weeks later they suffer another one, then they'd be under an even more careful watch and probably a little bit delayed of a return to play. But it's more of the one right after another, like same game or a couple days after even.
Okay. Well, that's all I have for you.
All right.
I mean, pretty good job.
Thank you.
I'm sorry that there wasn't anybody else here. In fact, I feel bad about that. I invited all of your fellow honor students and everybody in the honors committee.
Oh, that's all right.
And,